The Douglas and Nancy Barnhart Cancer Center is part of the Sharp Chula Vista Medical Campus.
This is the radiation therapy treatment room, and this is the linear accelerator.
Dr. Philip Zentner is a radiation oncologist. The linear accelerator is one of the most powerful tools for treating cancer. The machine uses high-energy X-rays to destroy cancer cells. Dr. Zentner says he can attack tumors with sub-millimeter accuracy.
And so we can treat really small lesions, we can treat brain lesions, we can treat very sophisticated treatments with this machine. And we can also do things that are really, really simple.
Radiation therapy can be used in combination with surgery and chemotherapy to treat cancer. But as Zentner explains, it's also used to help ease the pain of patients whose cancer is too far gone. And in those cases,
the primary endpoint is really about comfort care, about how do we make this patient comfortable.
Zentner says California's new aid in dying law gives patients another option.
For some patients, it's going to be a very welcomed option because they're going to be in tremendous pain or they're going to be in suffering. And for those of us who have witnessed patients go through this process, there's going to be some patients who are going to choose this option that before this was not available for them.
Critics of California's law believe it will create an environment that could encourage people who are terminally ill to take their own life. But that hasn't been the experience in Oregon. In 1994, Oregon became the first state to approve a so-called death with dignity law. Last year, 155 people in Oregon died from taking a lethal dose of drugs under the law. That represented less than 0.5% of the total number of deaths in the state. Advocates say the law has prompted more people to take advantage of hospice care. In fact, Medicare data reveals in 2013, Oregon had the 6th highest utilization of hospice care in the nation. Supporters hope California's law will lead to similar trends here, and they hope it will compel doctors to become more comfortable talking about death.
Scripps has its own hospice.
Okay.
Dr. Holly Yang specializes in hospice medicine and palliative care at Scripps Health. She says doctors don't get much training in having end-of-life discussions. Yang says, as a result, they often do a disservice to terminally ill patients who have questions about what lies ahead.
And we simply just say, oh gosh, I feel sorry for you, here's a prescription. Or we say, I don't do that, sorry, don't talk to me about that. That doesn't actually address the root cause of why they're asking. It doesn't get to the heart of the matter, which is I'm in a vulnerable place, I'm worried, and my family needs help, and so do I.
Dr. Robert Wales is a pain management specialist with offices in Oceanside and Encinitas. He says in other states with aid in dying laws, more people have requested a lethal dose of drugs than have actually taken them.
But I think that's a good reflection of one of the reasons why patients want to have this available, is just to have control, to have that option. And they may not exercise the option. Again, the majority of patients do not exercise the option, even though they have the means to do it in hand.
Here we go.
Tomorrow, in our final episode,
Up the hill.
we'll visit with a San Diego woman who wants to take her own life before her disease takes total control. Kenny Goldberg, KPBS News.